This video is part of our tuning fork first aid series. This one's going to be on minor cuts. What I'm talking about is something that's small enough to not need stitches, and it could be a slightly old cut, but you can start working on this cut as soon as you have it. You should still do everything that you normally would do, like clean it, put a band-aid on it, and it's probably better to put a band-aid on it first before you start working on it, rather than working right on if the cut is still bleeding or something like that. You would want to clean it and have a band-aid over it so you can work on the band-aid if you need to. What I have here is a weighted tuning fork, and these are what we use within our first aid series because we work right on the body with this tuning fork. This one happens to be 128 Hertz, and notice that it doesn't have the extended handle. We don't have any extensions or attachments onto this. And by attachments, what I'm talking about is something like this, where we have something added to the end of this. What we call this one without an attachment, we call this a barefoot fork. That's how we term it within New Earth Healing Center and NEC Academy, where we teach methods and techniques using tuning forks. So what you want to do is with a cut, and I'm just representing, this is not a cut, an actual cut, but I'm representing the cut right across here. And let's say that I've already cleaned it, I've already put a band-aid over it or something that's covering it, whatever you would use to cover it to keep the oxygen out. And it could be a day or two old if you need to. You know that with the inflammatory response, there's going to be swelling and there's going to be fluids start to build up. And the process that happens, the anti-inflammatory and the acute inflammatory process is going to be happening for the first couple of days, especially as it starts to heal itself. But you can do this either on the first day, you can do this within the first couple of minutes after you get the cut, after you get all the processes done to get it all taken care of. So you definitely want to cover it with something, and the Band-Aid would work. If it's a large, long cut, something you think you should go to the doctor or to the emergency room or something, by all means, this is not a replacement for something like that. These are very, very minor cuts. One of the things you need to be considerate of is the fact that a tuning fork like this has a little divot or a little hole on the end of it, which can end up being, if you're pressing down on the skin, can end up being a little bit of discomfort. And our main purpose for what we're about to do is just to get a lot of the fluid and the anti-inflammatory fluids away from that cut. The fluid buildup, which we think of as inflammation or swelling, that's something that happens as part of that process. The problem is that most of us are already full of too much fluid anyways, so you get where cuts take a little bit longer. When you were very young, you may have had cuts that seem like, if they were small cuts, seems like you put a Band-Aid on it or something, and then they heal by the next day when you get up. We're still able to heal that fast. The problem is that due to the things that we do in our lives, our body's capability of healing itself very quickly makes it a little more difficult. Our acute inflammatory repair process is just drawn out and it's a little bit slow. One of the reasons is because there's too much fluid around things like cuts and punctures and things like that. So what I would end up doing is striking this weighted tuning fork. And the reason I want a weighted tuning fork is what's happening down here at the base of this stem, which I'm going to put up against my skin, the weight distribution here, the weights that are happening here, and then the vibration that's happening here is a lot stronger because of the weights at the other end. There's a undistributed weight across the entire length of this tuning fork. Most people think that with tuning forks that are weighted, that this is 128 Hertz, so these tines, each tine is moving back and forth in 128 cycles or swings back and forth, 128 times per second. Sometimes some people think that that's what's coming out of the bottom of this tuning fork, and that's really not the case. It's more than just that, because this is a piece of metal that as there's movement down on this end, there's flexing down on this end, and it's more than just the movement of the tines transferring down. There's actual flexing just like any other metal would flex. So we don't want to add things onto the end of this. We want to grip it right as well. This is a grip that's not a normal grip for the sound healing community, although I believe it should be. When we're going to grip this tuning fork, we're going to grip it right up here on the fattest metal part, because we're going to clamp our hand right down on it. It doesn't dampen the tuning fork vibration at all. In fact, if you were to hold it down here on the stem, it would be a little more difficult to put downward pressure on your skin. So we want to grasp it up here in between the thumb and the pointer finger. So I'm going to strike it in the method that I normally strike. I'm striking it up against the palm of my hand. I'm going to take it and put it right on the cut itself. Now remember, there's some sort of barrier here, and I would want to make sure that the bleeding has been taken care of. And there might be a little bit of bleeding and some seepage that's happening underneath the bandage, and that's okay. If it's bleeding profusely, chances are you should go in and get that taken care of. Maybe you need stitches. What I'm trying to do here is get the inflammatory process to speed up and get the fluids, the swelling, the redness, and the things we usually know of that goes along with inflammatory processes. We want that to speed up. And actually, this process with the tuning forks and the cycle of the tuning forks makes everything speed up, the entire healing process. So what I'm doing is I'm working right down the entire length of that cut, and I'm basically moving it about the same width as the diameter of the tuning fork. And I'm pressing against the skin just enough so when I press in, if I press any more, I would actually move my arm. That's a little bit too much. So it's not a light hold. You do want to press down on the skin a little bit. What that's doing is it's stretching the collagen fibers that are in your skin, and it's actually communicating with the cells, and that's what's speeding it up. There's these cells that are part of the healing process, and they need constant reinforcement of the commands that they're using, and it makes the timing of that whole process faster than it normally is. So keep striking, keep placing it all the way down. You may feel some pain, especially if the inflammatory process has already started. If it's a couple hours old or a day old and it's red and puffy and swollen and things like that, it's probably going to hurt when you put the tuning fork on it on the first time. Remember that there's fluid pressure in there, and sometimes the fluid gets caught into spaces. And what makes us hurt when there's inflammation is the little nerve endings that are the pain receptors are being compressed, as the fluid around those nerve endings are already pressurized, and you're coming in and adding more pressure to it, which compresses the little nerve endings, and that sends information up to your brain to say that it's hurting. So when the pressure is already bad there, of course, when you press down on it with a tuning fork, you're putting even more pressure in there. So that will start to reside a little bit, or recede. The pain will recede a little bit when, and probably by the time you're done with this, you'll have no pain at all, and the redness would go away. And so that's the things that you're looking at. The redness will go away, the puffiness goes down, the swelling goes down, and then what you should see is the accelerated healing process of a cut. And it is possible that if it's a smaller cut, that it could resolve within one day, and where the entire thing is closed. And it seems like it would have sped up like a day and a half, 2 days, 3 days, depending on how much you do it. If it's a larger cut, you may have to do it multiple times, a couple times today, a couple times tomorrow. Keep checking it, and what it does is it speeds up your healing process. And let me move this screen down. I'm going to go to the next screen. So we are NEHC Academy. If you want to go to our website, NEHCacademy.com is our website. We have a Facebook page if you want to type in or do a search for NEHC Academy. And then we have two main things that we teach within the Academy. So the first aid series is all free that we put out on YouTube. but we do teach VFRT, which is vibrational fascial release technique, which uses the weighted tuning forks. And those are methods that are much bigger methods to where we would use those as a professional would within a healing practice of their own. And there are vibrational fascial release technique therapists, VFRT or vibrational therapists throughout the world, and we have trainers throughout the world as well. On the right hand side is our logo for vibrational chronotherapy, and that primarily uses unweighted tuning forks, and that would be more for rehabilitation purposes and for cognitive therapy, speech therapy, gait and movement therapy, things that would happen after we can get pain and mobility restrictions taken care of with VFRT. Then we would do a follow-on rehabilitation with VCT, and that has to do with the way that the body's timing happens and needs to be recalibrated, resynchronized, reset. That would be our version of tuning. And so this series, if you'd like to join us for more videos, we have more first aid videos. If you'd like VCT training, that's actually free and available on our website, and the VFRT is paid training, and come visit us on our website.